That's right. Hormone replacement therapy has grown rapidly over the past several years. But is it really safe? Dr. Rob is here to explain the potential risk. And Kelly just said having an apple a day, that will maybe keep you away. Is that true?
Yeah, I eat an apple a day so I can stay away from myself.
Yourself?
Right?
So,
he gets it.
He gets it. I liked it.
Yeah.
So let's talk about this. There's all kinds of different hormone replacement therapy that women are taking, some in the form of birth control, things like that.
Yes, there are a multitude of hormone replacement therapies that are on the market, not only synthetic, but bioidentical. Then there's birth control pills that we see on the screen right now. And so how do you know if it's safe for you to be taking hormones? Because in general, they are very safe. However, there are individuals, both men and women, that have pre-existing clotting disorder problems who probably don't really want to be taking these because it could lead to having blood clots. The question is how do you know if you're one of those people that has this clotting disorder?
How do
and
we
we've
know?
got a list of the most common ones that we can put up on the screen that we can talk about.
Perfect.
And you know, these factor deficiencies. So there's factor 2, factor 5. These are the two most common, what we call thrombophilias, reasons for having blood clots. And so we screen for these. Then there's factor 8, factor 11, and then MTHFR, which stands for methylene tetrahydrofolate, and then there are some other ones. But these are the most common thrombophilia hypofibrinolysis problems that really all men and women should be screened for prior to going on hormone replacement therapy. Yes.
So what we're seeing on the screen is what we should be screened for.
Yes. And what's interesting is with all of these therapies, whether it's bioidentical or synthetic hormones, this actually isn't in the textbooks. It doesn't talk about, hey, you really need to be screened for this before you start these therapies. It's one of the more unknown things that needs to be taken care of. A lot of doctors don't even know about it. And that's where that's where the rub is. You'll have an 18, 19-year-old girl who starts birth control pills and suddenly throws a blood clot, and everyone's going, why? She doesn't smoke, she's young, but it turns out that she has one of these thrombophilia hypofibrinolysis problems that was never screened for. So the important thing is to make sure you get the right screening before you consider going on hormones. It's estimated there's about 75 million people that go on hormones each year.
That's crazy.
Right, so it's a hidden danger that people really don't know about.
Yeah. Now, can we come and see you and you can help us with these screenings, or should we go to our actual family doctor? What's the best way to do that?
Well, you can ask your family doctor, but yes, you can come to me since this is what I specialize in. These are the things that we do when we screen for these disorders prior to instituting therapy so that we know people don't have them.
That makes a lot of sense. What do you have on the table here before we go?
Just a couple different therapies. Some of these are actually look like deodorant sticks, but you take the top off of them. And you can actually, they're creams.
So this is a hormone replacement right here.
Yep, and you can turn the base and the cream comes out the top. It's actually bioidentical. Some of these are actually capsules. This one in particular happens to be DHEA, so you can get hormones in capsules as well.
Excellent.
So there's different types.
Depending on what you really like. Where can we find more about you and hormone replacement therapy? Obviously, you're an expert, and we would love to come see you if we want to get screened.
Yeah, if you want to find out more about hormone replacement therapies, specifically bioidentical, then the Alpha Male Medical Institute, where we treat men and women, but alphamaleinstitute.com is where they can find plenty of information on all the different bioidentical hormones that we can use to help you feel better, increase your vitality, your strength, your energy, endurance, make your skin look younger. A lot of women don't know that some of these hormones, actually, they tighten up their skin so they look youthful, right?
Excellent. Dr. Rob, thank you so much for this great information. Go see Dr.